Bismillah ar-Rahman ar-Rahim, and a very good morning to all of you. First of all, correction. The founder chairman of Rehman Medical Institute is Professor Mohammed Rehman. Many people in Karachi would already be familiar with him, so that's just for the record and the correction. Some of you might be familiar with the Rehman Medical Institute, but if I can request that we show a brief video so that everyone's familiar with it, please. Thank you. So Bismillah ar-Rahman ar-Rahim. First of all, thank you for the opportunity to join at this wonderful conference. I represent Rehman Medical Institute. It's a 650-bed hospital located in Peshawar, Pakistan. It also has 5 different colleges associated with it, offering 18 different undergrad programs, 2,500 students enrolled right now, and covering almost all disciplines. So I'd like you to imagine this picture of a patient coming from abroad, from Bangladesh or Central Asia, bringing his father over for treatment just because someone told him go to Pakistan and that's where you'll get the treatment that you deserve. That patient going back, treated, and relieved, and being looked after, that's what medical tourism is. It's not glossy brochures, it's not websites, it's not ads, it's basically trust. The key ingredient for medical tourism, and we've learned this from experience of 2.5 decades now, is establishing trust, because no one is going to travel to another country unless that is truly established. I know our other colleagues have already talked about the opportunity that exists. Some statistics tell us that by 2029, this is going to cross $100 billion. It's a significant industry. It's a huge industry that many countries have already tapped into. And I feel it offers a massive opportunity for us in Pakistan as well. India, Thailand, Turkey are some of the biggest operators in the medical tourism market. And there's so much experience share that can happen, and there's so much learnings that can happen over here. We often look at the glass half full. We look at the challenges that Pakistan has. We have a perception challenge. We have a law and order challenge every now and then. But then we have a number of natural advantages as well. And I think it's so important for us to leverage the natural advantages that we have, some of which were alluded to in the earlier talk as well. First and foremost is the healthcare workforce that we have. Pakistan has more than 180 medical and dental colleges, and there's more coming up all the time. Allied health professionals are being produced in a massive number, and there's a constant increase. And I have to say that while there is a huge need for the quality to be standardized and improved, but the numbers are there. So you've got a workforce, an English-speaking workforce, which is a key ingredient for any healthcare sector in any country. We then, as was mentioned earlier, have a huge clinicians diaspora all over the world, whether it's the NHS, whether it's Canada, the Middle East. There are so many Pakistani clinicians doing wonderful work all over the world. And some of those clinicians choose to come back to Pakistan. Those are individuals who understand international standards of care, they understand patients' expectations, communications, transparency, and that really offers a natural bridge for the Pakistani healthcare providers with the global standards. And then we have the diaspora as a whole, and there are varying statistics, but there might be as many as 10 million Pakistanis who are living outside Pakistan right now. And those Pakistanis do have healthcare needs. And in many of the countries where they're living in, access to healthcare is a very serious challenge. We're all familiar with the problems, the waiting times in the United Kingdom and many other countries, and the affordability issues as well. I feel the Pakistani diaspora is a low-hanging fruit, because not only are you giving them a significant price advantage, they also have this, they're familiar with this country, there's no language barriers, and they get an opportunity to come back home, obtain treatment, and then go back to the countries where they're living in. And then we have the culture, looking at the Middle East, looking at Central Asia, looking at many African countries as well. Those are all countries that are quite accessible. Many of them are less than 3 hours flight away. In many cases, we share a similar culture, we share the same religion, we share similar values, and that cultural comfort at times can matter a lot more than the price. And lastly, there is the price advantage. You know, it is important to recognize that as well. For a comparable level of quality, Pakistan still offers a very competitive price when compared to so many other countries in the region and many other global operators, which in this case is a massive opportunity and not a weakness. So I'd shed some light on the RMI experience and how we entered the healthcare tourism market. First and foremost, it was completely by chance. It was not by design. We did not intend to operate as a recipient of international healthcare tourists. It was just, as they say, being at the right place at the right time. 2001, 2002, when RMI was just starting off, as some of you might be familiar with the geopolitical situation in our neighborhood back then, a new government was coming in, there was a war happening in the neighborhood, and suddenly you had a country that did not have any healthcare infrastructure, that now suddenly had a lot of resources being pumped into that country, and it had people who were requiring that healthcare, and we had a very porous border, which meant that people could literally walk across for services that they needed. And right at their doorstep, Peshawar being very close to the border with Torkham, you have a brand new hospital offering all tertiary care services that had sprung up. Within the first couple of months, we were flooded. You know, all the capacity was fully booked, and we were aggressively working on expanding. We added more beds. What started off as a 100-bed hospital rapidly grew. What started off as 2 specialties turned into 20, and we just responded to this demand. And we therefore became the most convenient and the most obvious destination for all of those medical tourists from Afghanistan that were coming over. We didn't have a plan, we didn't have a department called International Patient Services, but we did what we always do best. We responded. We observed that there is an opportunity, we identified the needs, and we responded fast. And this is a lesson learned for everyone. You know, as you go along, and we learned this in COVID as well, the importance of being resilient, the importance of responding to changes in the external environment, and Afghanistan shares a very similar culture. For our part of the country, a common language for many of the people as well, but there's many other languages in Afghanistan. So we realized that there's a need for interpreters. So we started hiring interpreters to help with communication for patients who did not speak Pashto. And then we felt maybe that's not good enough as well. At times patients do need to communicate, and you can't have interpreters all over the place. So we started arranging Dari language classes for our clinicians, doctors, nurses, and other caregivers, just to facilitate their communication with these patients that are coming over and their families. We had a lot of patient education material, but a lot of that was in English and Urdu. So we started translating that and producing that in all the regional languages as well. The dietary preferences for patients from that country in many cases were different. They would come in with a different currency, so we established a currency exchange on campus. They would come with their companions and family members, and they needed accommodation, and it was not easy to find accommodation in Peshawar, so we established on-campus accommodation for them, transport, a shuttle service to the border, visa facilitation, telemedicine consultations. The patients taught us what they require, and we responded. And that is why we probably handled one of the largest volumes of international medical tourists into Pakistan along the way. So what are the key lessons that we've learned from this journey of almost 2.5 decades now? The first is patients do not travel for discounts. Patients travel for trust. You can give them rock bottom prices, but if they don't trust you, you can offer them free services. But people are not going to risk their lives unless they trust the service that you're providing. So that's first and foremost. The second part is much more than the slogans, it's the little operational details that matter. If you look at these things in isolation, offering a cuisine, offering that Japanese newspaper in the waiting lounge, offering interpretation services, those are all individually little things, but it's the little details that matter and impact the overall experience, not just for the patients, but their family members that are also coming with them. And the third part, and the third realization or the lesson learned was that word of mouth works faster than the best advertising in the world. You'd be surprised. We, as I said, have handled some of the largest volumes of Afghan patients in Pakistan, and we've never had a single billboard in that country. We've never had a single radio advertisement in that country. We've never had a TV commercial or a newspaper, none of that. It's just word of mouth. I know times have changed and we need to adjust, but it just tells you on the power of the word of mouth. Every one patient that was looked after and treated well went back and told 10 others. This is how I experienced healthcare. Please go ahead and do it. And we, of course, leveraged our natural advantage. Our location meant that for some of the bordering regions, such as the Jalalabad or the Nangarhar province, people could literally drive over in the morning, get the services they require, and go back home the same day. So we leveraged the advantages that we carried back then, and we facilitated them. And since then, we've expanded medical tourism towards other countries. We have a very large number of Bangladeshi patients coming now for renal transplants, and there's many other services. There's a lot of patients from the Middle East coming in. We're actively looking into the African market now to see how we can tap those resources as well. It's also important to admit that there are gaps. There are very serious gaps, and now I'm talking about overall the Pakistani healthcare providers all over the country, and it's important to recognize and start doing something about those gaps. First and foremost is the lack of systemic coordination, and I loved the talk by Emin earlier on the need for there to be a coordinating body which gets all the stakeholders on one platform to see how they can pool resources, they can join hands in addressing some of those challenges. So that's what we don't have. We don't have a forum where Ministry of Foreign Affairs and Interior and the travel agents and the healthcare providers and the hospitality sector all sit around the table and determine how we intend to address this. Accreditation is an important aspect. Whenever we travel to another country and we find there is 10,000 hotels there, where do we want to stay? There's a rating system, there's evaluations, there's third-party accreditations, which give you that stamp of approval and give you that confidence on the place that you want to stay, or more importantly in our case, where you want to obtain healthcare services. So accreditations is key. Not all these hospitals can go ahead and get Joint Commission, but there's so many other accreditation opportunities, including the accreditations right here in Pakistan through our respective healthcare commissions. And then there's the visa and the travel barriers, where the government needs to step up and recognize this as an opportunity to see how we can facilitate them. If there's extensive paperwork, many of these cases are time sensitive. People can't wait for 3 months or 4 months just to get their visa paperwork sorted out. And lastly, I feel Pakistan overall and Pakistani healthcare specifically suffers from a branding problem. We have a major issue as far as perception of Pakistan and Pakistani healthcare is concerned, and that can only be addressed if we come up with a unified identity for private healthcare or the healthcare providers in Pakistan. It can only be done collectively. There needs to be that one key message, one logo, one promise on what is Pakistani healthcare for a patient from anywhere in the world. And I feel this is where the private sector really needs to lead, because medical tourism is very much a service export, and it should be treated as such, both in terms of policy and trade strategy. So some of the healthcare providers that are here, what is it that we could do? So I have some suggestions for action points. First and foremost, everyone is getting some patients from outside their respective cities or the country. There needs to be an international patient desk. There needs to be a focal person. It could be just one person, and that's how it all starts, and then you gradually scale up. We need to map our strengths. No one hospital could be a center of excellence at 20 disciplines, but you could be a center of excellence in one. So mapping and identifying that one strength and really working on that, leveraging that, and ensuring there's adequate visibility around the same. Creating patient pathways right from the moment the patient leaves his or her home in their home country to the moment the patient goes back, and thereafter is a complete patient pathway that needs to be mapped out and facilitated. I think publishing data is something that we're very poor at here at Pakistan, and that's absolutely essential when it comes to establishing credibility and getting trust. And most importantly is working on this network. We have to pool our resources, we have to join hands, and by we I mean the healthcare providers and the other stakeholders in this overall ecosystem to see how we can all work together towards achieving this goal. It's not going to happen overnight. It's taken people decades to get where we want to get, but one has to take a start, and it could start off with a very small number of providers and travel agencies and other stakeholders coming together and chalking out a plan and working towards it. I'd also want all of us to recognize the ripple effect of healthcare tourism. The common perception might be that healthcare tourism benefits the hospitals. Not at all. I mean, it has a multiplier effect. You know, pharmaceuticals benefit from the same, hospitality, retail, logistics, airlines, everyone benefits. But what I feel is the greatest advantage of healthcare tourism is the image of this country. Imagine thousands and millions of patients getting treated from here. What is the image do you think that they'll be carrying regarding this country? Regarding of whatever political differences we might have with any country, the soft image of Pakistan can really be enhanced through medical tourism. So I think the road ahead is, you know, positioning our Pakistan as a healthcare tourism destination. And I also want to highlight the fact that healthcare tourism doesn't necessarily have to be for the 5-star hospitals only and the Joint Commission hospitals only. Just like conventional tourism, there's a market for every segment. You know, it's not just the 5-star hospitals which are flourishing through tourism. There is a demand for a 4-star or a 3. There's a demand for every price point. Of course, it needs to adhere to certain established levels of quality, but there's a demand for different price points. There's a demand for different specialities and disciplines, and those are the areas that we need to leverage. There needs to be, you know, imagine a situation where all the embassies that we have all over the world have a Pakistani healthcare desk which just focuses on facilitating inbound medical tourism into Pakistan. So finally, I'm very optimistic for the decade ahead. I think there's immense opportunity for us. We have the talent pool, we have an enabling environment. This is probably the 3rd conference on healthcare tourism within the last 6 to 8 months, which tells me that there's increasing appetite both at the public sector and the private sector to do something about this. And I think it's high time that we build a system so that ultimately the slogan of treated in Pakistan is looked at as a badge of trust and not something that is a surprise. So thank you very much, and I'm very pleased that, you know, Health Asia has recognized medical tourism as an important segment, and it's the first time this is being held there, and I look forward to this flourishing and interacting with many of you later on to see how we can take this conversation forward and make a real difference. Thank you very much.